This video is brought to you by Lionsden. Autoimmune disorders. Autoimmune disorders are diseases in which the body's immune system attacks its own tissues, mistaking them for foreign invaders. The exact cause of why the immune system starts to behave this way is often unknown, but it's believed that a combination of genetic, environmental, and other factors play a role. Symptoms. The symptoms depend on the type of autoimmune disorder and which part of the body is affected. However, common symptoms can include fatigue, muscle aches, low-grade fever, skin rashes, hair loss, joint pain, inflammation, swelling, difficulty concentrating or brain fog. Causes. The exact causes of autoimmune disorders aren't fully understood, but it's believed that a combination of the following factors contribute. Genetic factors. Environmental triggers, like infections or sun exposure. Some drugs or medications. Hormonal factors. Risk factors. Certain factors might increase the risk of developing an autoimmune disorder. Family history. If family members have an autoimmune disorder, you might be more susceptible. Gender. Many autoimmune diseases are more common in women. Ethnicity. Certain diseases are more common in specific ethnic groups. Environmental exposures. Viral and bacterial infections, certain drugs, and sun exposure have been identified as potential triggers for some autoimmune diseases. Diagnosis. Diagnosis can be challenging due to the wide range of symptoms and the many different types of autoimmune disorders. Common diagnostic tools include blood tests to look for certain types of antibodies, imaging tests, biopsy of affected tissues, comprehensive medical history and physical examination. Treatment. The main goals of treatment are to reduce symptoms, control the autoimmune process, and maintain the body's ability to fight disease. Treatment might include immune-suppressing drugs, hormone replacement, as in diabetes or hypothyroidism, physical therapy, blood transfusions or intravenous immunoglobulin for certain disorders, healthy lifestyle practices, like a balanced diet, physical activity, stress reduction. Complications. Depending on the type of autoimmune disease, there can be a variety of complications. Organ damage. Increased risk of infections due to immune suppression. Side effects from medications. Increased risk of other autoimmune diseases. Increased risk of cancers for certain autoimmune conditions. Autoimmune disorders are varied and complex, so specific diagnosis often requires a specialist's expertise. If someone suspects they have an autoimmune disorder, they should seek medical attention and potentially get a referral to a specialist, such as a rheumatologist, endocrinologist, or dermatologist. Thank you for watching. Try Lionsden seltzer.